That's great, thank you. So Rhian, can I throw to you now? We've done a lot of profiling, particularly recently, and you mentioned through COVID the partnerships that we've had. If our partnerships are so good already and we're working so well together, why do we need to go further in terms of this change?
Thank you, Jenny. So partnerships with other health services is already essential to healthcare. We work together to provide better local services like cancer and geriatric care, and of course, most notably, the recent COVID-19 response. I suppose as an example, when we were doing our vaccination clinics, and it shows why working together will be so much better. We were 4 siloed health services all rolling out the same programs with the same regulations and the same quality controls, but we were doing it individually. Now, there might have been that lead service from Ballarat, or there might have been some assistance from our government, but if we were all part of one group, a lot of those things would have been done as a group, and then we could have rolled out the vaccination program as it stood. So I suppose that's given an example also of the Victorian public hospital system, which is the divulged governance model. And we're all responsible for our own patch. So we have our own services, our own performance indicators, staff in our communities. But our services often have to compete for funding and for staff. And we have to duplicate all of the administration and the compliance that comes with those being separate entities. So if we work together, our partnerships rely on a shared interest and the mutual goodwill at the moment. At the end of the day, each service is responsible for its own performance and challenges. So we are unique and different from other states. Public hospitals in New South Wales and Queensland are run by regional health districts. Those systems plan, coordinate and share their resources across the region, and we don't always have the level of connection to their community that our services have. So what we've designed in this last 12 months is an option of a new health service based on the best elements of their experiences, combined with the benefits of our system, which will ensure our local communities will have their own services. Thank you.
Thank you very much. Mari, I just wondered whether, in the interest of saving Natalie from her bad connection, whether you'd be able to tell us a little bit about what this means for staff across the 4 health services.
Yeah, happy to assist Jenny if I can. Just by joining together as one health service, our talented and passionate healthcare workers will be able to flourish in their careers through improved training, development and career pathways. Together, the 4 health services will be one large employer able to attract and sustain a larger workforce pool, especially for specialist roles. It will also reduce the reliance on temporary staff in regional and rural communities. The decline in activity at Horsham, Edenhope and Stawell reduces opportunities for the workforce to develop and maintain specialist or advanced knowledge and develop skills. By joining with Ballarat, there will be opportunities to provide staff at Horsham, Edenhope and Stawell with rich and rewarding development opportunities and pathways, using the wider scale and breadth of practice across the region. Getting access to specialist clinicians is already a major challenge for rural health services. I mentioned that in my introductory comments. It's particularly relevant to Wimmera Healthcare Group. Staff shortages are a major challenge and under the current arrangements are resulting in less local service delivery. Creating a new health service we know is not a magic bullet, but it will make it easier to attract and retain staff to the region in many ways. Staff working at our local health services would get the benefits of working in a more personalised, smaller health setting and in a rural community, while also getting the training, development, research and career opportunities that a bigger health service offers. There'd be better support for staff in terms of supervision, peer support, leave and backfill arrangements, and access to leading practice and research. This will help attract and retain specialists locally, we hope. a larger pool of specialist clinicians to draw on, including generalist clinicians developing specialist capabilities, so that the need to travel for our community members or for our specialists and for the community is more widely shared. A larger critical mass of services provided locally so that specialist and subspecialty practices are sustainable, and a comprehensive training and development program within the region to build up a strong and sustainable medical and clinical workforce for the long-term future.
Thank you. So while I've got you, oops, sorry, someone talking as well? No. How can community and staff be involved then? I know that this is a proposal that's been submitted to the department, and we now wait for a response from the Minister. But in the meantime, what can staff and community do to be truly involved in this co-design process? Sorry, Mari, you're on mute again.
Yes, sorry about that. So far, we've engaged more than 1,000 Horsham residents, 250 Edenhope residents, and many Stawell residents across community and staff surveys, staff workshops, in-person and online consultations, meetings with community groups such as Rotary and local government, pop-up stands in community locations, online feedback forms, submissions and print, news and social media. Facebook feedback, ideas and concerns have been gathered through this process, and they've been integral to the board's deciding to proceed. While the Department of Health and Minister for Health review our proposal, we'll be meeting with community members to discuss the reasons we've made this decision and to hear ideas about how the new health service can increase quality health care in our region. You can be involved as you would like to be, reading information on our website, attending a coffee catch-up meeting, participating in a co-design workshop, or joining an advisory committee. There'll be lots of opportunities. It's crucial that this process is an active collaboration with all health services involved and with the people who are currently at a disadvantage due to lack of access to safe, effective healthcare close to home. Staff across all 4 health services will all be invited to design the future vision, outcomes and values of the new service. Just a little bit more, Jenny, we'd like to reiterate the commitments that we've made all along and that have been embedded in the future path we've chosen. There will be no loss of services at any of the healthcare services forming the new entity. There will be no net job losses, reduction in entitlements or changes to existing staff conditions. Local identity and connection to the local community is important, with place names remaining, hospitals, health services remaining in place, and local representation will be on the new board. Past and future fundraising will be tied to the community and the purposes it was raised for. The new health service will grow services, improve care and create new opportunities for staff at each local community.
Thank you, Mari. Now, Rhian, I'm going to throw you one that Rhiannon from ABC has popped in the chat, just because it is something that you mentioned, and I know that you are across the process as well. So Mari mentioned there that names will remain local, that funds raised will stay in the communities where they were raised. And then Rhiannon from ABC wants to know, how can we guarantee that there will be local board representation? So could you talk us through a little bit around how we can actually make those guarantees?
Yes, absolutely. And it's a great question too. It's something that was really a talking point a lot throughout the last 12 months of planning. And what we've proposed to the Minister is that we ensure we have local representation from each of the 4 communities on the board. And we can ensure that happens because we've written into the legal bylaws of the service that we've proposed to the Minister. We've also written it into an agreement that we've asked for the 4 services to sign and that the Minister will also see. And we have also ensured that we have the right representation, the right skills from those communities to make that new board the best representation of each local community.
That's great, thank you. What about for the foundations who might be raising money, the ladies auxiliaries, that sort of thing? How can we guarantee that money will stay locally rather than being absorbed into a new organisation?
Oh, thank you, Jenny. I failed to mention that, and that's one of the most important things for each of our local services. The fundraising that our ladies auxiliaries and our sporting clubs and our donations even are provided, then will always remain tied to the entity it has been raised for. That has also been written into the agreement and the requests that we've sent through to the Minister, and they were things that we were not willing to give up. They were things that were really important to the local identity of each of the 4 separate services.
That's great, thank you. Now, Dean has just popped a question in the chat, and there were a few questions which were really great come through from Dean in terms of the reach across the region. So, Mari, I'm just wondering if you could answer for us why it's only these 4 health services and why in particular it's these 3 health services joining with Ballarat that's further afield than potentially some other health services within the region. And in the chat question, Dean has referenced West Wimmera services.
Yeah. Thanks, Jenny. First of all, I'd just like to reiterate, as I mentioned earlier, that we did in the first phase of the process invite all the health services to participate in the project, and a number of health services considered it, and then the 4 of us have decided to proceed. The range of specialisations available, particularly at Ballarat Health Service, help Wimmera Healthcare Group to provide the sub-regional level of services that we need to be providing to the region. And we will continue to do this. One of the reasons we're going down this path is because we want to do better to provide the higher level of clinical services that a sub-regional health service should be delivering locally to the whole region. I spoke to the chairs of both Rural Northwest Health and West Wimmera Health Service this morning and reiterated that, one of the primary drivers for us to go down this path is that we continue to deliver great services or better services than we've been able to for the whole region, including West Wimmera and Rural Northwest Health and the smaller communities that are serviced by our region.
Thank you, that's great. I hope that answered those questions, Dean. Now, either Mari or Natalie, I don't know if Natalie's available. A question has come through around the different models that were investigated as part of the process. Are you able to sort of talk through the different options that were investigated and the due diligence and the process?
Yeah, so a number of people felt, why don't we just go down the partnership track? Why don't we just use the partnerships we have or have more formalised partnerships? And one comment that was made by somebody who'd been involved in health services for a long time was that it was the definition of insanity to keep trying to do the same thing and expecting a different outcome. That partnerships can only take you so far, and that it's a very slow process to achieve reform, and that if we really wanted reform into the form of improved health services in the region, we had to do something different. We had to formalise the partnership into more than a partnership, but a single entity where we're hand in glove, lockstep, working together jointly at the hip for better outcomes for the region. And that's what we've done through this process. We did consider that it would have been in some ways an easier and more palatable option for lots of people, but it wouldn't have achieved the outcomes that we need to achieve within the timeframes within which we need to achieve them. And that's why we chose the path that we have chosen.
Thank you. Mari, did you want to add anything to that point?
I think Natalie answered that very eloquently, Jenny. But yes, I suppose like to reiterate those comments. We did explore various other partnership options, one of which was suggested by particularly community members in our part of the world, is that perhaps Wimmera Healthcare Group should be joining with the Wimmera Southern Valley Health Alliance's Health Alliance partners. And the reason that we've opted to not do that is because the sorts of services that we as a base hospital provide to the region and to all the partners in the Wimmera Southern Valley Health Alliance are more aligned with those sort of higher level clinical services that we access via the larger health service such as Ballarat Health Service. So we'll continue to work in partnership with all the other health services as part of the, we're all part of the Victorian public health sector, and we'll continue to support the work of the Wimmera Southern Valley Health Alliance and a number of other sort of organisations. But we see the way forward, the way that we can really reform and improve and hopefully address some of those dreadful health statistics, is by partnering with large and small health services together.
That's great, thank you. So one last question that has come through before I'll give everybody a chance to have one last comment. It's around staffing, and I'm not sure who would like to take this. Maybe Rhian, would you like to talk about this? So this is a very specific question that people from the region might need to travel to Ballarat if there's staff shortages. What will the process be? I know these sorts of things haven't been looked at yet. So what will the process be for those discussions?
For staff moving amongst services, sorry?
Yeah, and the planning that's going to happen from here in terms of resourcing the various different services.
I'm not sure. Look, what I do know is that our staff were at the very forefront of our minds when we were making up these decisions. We really needed to make sure that we were supporting them to do their jobs in the safest and with the best, or in the safest way, and in the best way they could. Our community told us that they had some concerns around having to move around the region, and that wasn't our intent for our staff. We will have full retention of our staff and their entitlements, and hope to give them better opportunities for the future. By joining together, we won't have to do individualised professional development for them and the like, and we hope that by offering them greater opportunities to improve their own skills, but also to move up through the chain of promotion.
That's great, thank you. So I'll just send it over to Philip now, if you'd like to make a final statement.
Thanks, Jenny. And look for our health service, we see that this is going to increase our acute and allied health services that will be available locally, just reducing the need for our patients to travel across the whole region for the care that they need. We also see that this will improve the sustainability of our local services by achieving higher activity and utilisation levels for our acute services and increase our aged care occupancy. This increased capacity to deliver low acuity general medicine, palliative care, renal dialysis services will result in increased acute activity for our organisation. We'll also increase the utilisation of our aged care services through enhanced capability to provide specialist care for bariatric and dementia patients, residents, from improved care coordination across the region. And also, it's going to improve and be a more efficient corporate and clinical governance, and improve the quality and safety of care, reduce some of those administrative burdens that we have in compliance activities, and save some of those joint purchasing and administration arrangements that we're all faced with each day. Thanks, Jenny.
Thanks, Philip. Natalie, did you want to make a final statement?
Just in closing, want to assure the community that this decision has not been taken lightly. It's been taken to ensure the best health service possible across the broader Wimmera Grampians region, and for that reason, we're very confident that it's not going to have, so in part responding, I guess, to Dean's question here, a concern that will have the diminutive effect that some other changes, such as universities and so forth, have had, that won't occur, because we've come together as equal parties to improve the health services, and our whole philosophy will be driven by that outcome.
Thank you, and thank you for getting in. There are a few questions there that came in after that last question, so thank you for addressing that. Now, Rhian, did you want to say something to finish with?
Thank you, Jenny. I suppose by summing up what I have already said is that our community during the consultation.
Due to technical difficulties, the final section of this event did not record. This is the end of the recording.